Great. Well,
Okay. I'm sorry. What were you going to say, Jose?
sorry, Sam, go ahead. Sorry.
No, no problem. I was going to say good morning, everyone. We just wanted to get started here, 10 a.m. sharp, and want to thank you all who are able to kind of join in later on who are viewing this recording. We just wanted to go ahead and get started here. This is the 2023 Dallas County Annual Enrollment Meeting for active members, and we're very thankful to be joined by the vendors that Dallas County is working with. So we're going to go ahead and kick off this meeting with Jose Gonzalez from UHC. So Jose, if you can go ahead and share your screen and get us started.
Great. I will do that. So welcome, everyone. Then, as Sam indicated, this is the 2023 open enrollment meeting for Dallas County employees. What we will be covering today in the agenda will be updates that you should be familiar with, do a high-level overview of your medical plan options, the wellness programs that are available and wellness tools, as well as the UHC tools that will help navigate you through your healthcare journey. Now, in 2023, just to go ahead and ease your mind, just know that we are not making any plan changes in reference to either adding benefits or removing benefits. Everything's staying the same, but there is an update that you should be familiar with, and that update is that we are issuing new medical ID cards for everyone, regardless if you make changes or if you stay on your current plan. Just note that at the end of December, you will be receiving a new ID card, and we want to make sure that you understand that that ID card is the ID card that you should be using starting January 1st of 2023. It will look a little bit different than the current ID card that you currently have in hand. So please, again, destroy your previous ID card once you get your new one, and then as soon as you start going to your doctors, please make sure that you're presenting that new ID card. Now, in the next slides, what we're going to do is we're going to highlight some information related to your medical plan options. One of the first things we want to go ahead and do is cover preventive care. And why is preventive care important? The reason for that is because it's letting us know how our overall health is currently doing, and it helps with the providers in treating your health care throughout the year and as things come up. So what I want you to know is that preventive care, on regardless of which plan you elect, whether it be the PPO plan, whether it be the high deductible health plan with the HSA, preventive care is covered at 100% as long as you're going to an in-network provider. Now, preventive care, a lot of people just think of it as your annual physical, and there is a lot more to that it goes involved when it comes to preventive care. Now, this includes things like immunizations, age-appropriate preventive exams, and health screenings like a mammogram, a colonoscopy, things like that are covered under your plans at 100%. Again, making sure that you know that you have to seek care from an in-network provider. Now, if you would like to get a list of the full age-appropriate health screenings, you can go to uhc.com/preventive care, and there you will be able to enter your age and gender, and it will provide you a list of things that are covered under preventive care based off your age and gender. You can do this for your dependents that are covered under your medical plan. You can print this out and take this checklist to your provider so they can assist you with explaining to you what all those items that are on that checklist really mean. Now, another thing that is covered under your plan benefits is virtual visits. Now, during the pandemic, we did start seeing a rise in this particular service, and what it is, it's allowing members to still get care from a provider virtually, meaning from the convenience of your home, if you're on vacation, from the convenience of your hotel, if you're out of state, any states that you're available, you are able to get what is called 24/7 virtual visits. And again, all you would need to do is either get a tablet, have a computer with a webcam, use your smart device, and you will be able to connect with a doctor 24/7, 365. Now, the vendors that operate through this offering is Optum, Teladoc, Doctors on Demand, and AMWA. And what that means is that you would just download the application, go to the Google app or to the Apple device, and through the App Store, download these providers. You'll enter your insurance information, and if you are on the PPO plan, the cost of this service is absolutely free, meaning that you just have to enter your insurance information and the visit with this provider, and in case they give you a prescription, that visit itself will be covered at 100%, meaning that you will not have to pay anything for that visit. You may have to be subject for the pharmacy cost, but just know that that visit with that provider is covered at 100%. Now, if you are on the high deductible health plan, note that the cost of that is $49 until you've met your deductible. After your deductible has been met, then you will just pay your co-insurance level and the insurance pays at 80%. Please note that on our website at myuhc.com, you will get more information on this. And also in the chat of this particular presentation, we will be putting a more detailed presentation that you will be able to reference later as well. Now, the next thing is we're going to go ahead and talk about your plan options. The first one is the PPO. Now, as you can see here on the PPO plan, it does have an in-network and out-of-network option. And what that means is that you can choose from doctors that are in our network and have set amounts that you would have to pay. So for example, if you look at the bottom portion of the screen, it says physician services. Now for those physician services, if you go to a primary care provider, that's a $25 copayment. If you seek care from a specialist and they're one of those premium care providers that you can identify on the website with 2 hearts, then you would be able to pay $25 for that premium care provider or specialist, sorry. Now on the non-premium care specialist, you would pay $35. Again, like I mentioned in the previous slide, virtual visits with one of those 4 providers on this plan is covered at 100%, meaning you do not have to pay a copayment. Now, urgent care visits, if you go to the urgent care, it's a $35 copayment. You will not have to pay anything else at the urgent care copayment as long as they're in network. Now, hospital visits, in the event that you have to be admitted into the hospital, what you would have to meet is your deductible, and that's on the top portion of that screen where it says that it's an individual deductible of $500 or a family of $1,000. After that has been met, then we go into the co-insurance level and then the out-of-pocket maximum. Now, for out-of-network providers, we want you to make sure you understand that that means that those providers are not contracted with the insurance. If you choose to go to one of those particular providers that are not contracted with the insurance, you will have to meet your deductible and co-insurance level. And as you can see there where it says out-of-pocket limit, there's no limit, meaning that you will continue to pay for those services out-of-network throughout the rest of the year. If you stay in network, everything that you're paying, like your co-payments, your deductible, will be applied towards your out-of-pocket limit. Once you've met that limit indicated there, whether it be the individual or family, after that, for the rest of the year, the insurance pays at 100%. So there is a cap that you will have to pay, and then after that, the insurance then pays at 100%. Now, on the next plan that we're going to go ahead and discuss, which is the high deductible health plan. Again, this is a very, very quick high-level overview. This particular plan only has co-payments, only has deductibles, which means that there's no co-payments on this plan. So that means that if you go to your office visit, if you go to the virtual visits, if you go to the urgent care, what you have to do is you have to pay the contracted rate for that service. For example, let's make it easy. On the virtual visits, what we said is the cost of that is $49. So you will pay $49 that will be applied towards your deductible, and you're chipping away at that deductible. Once that deductible has been met, $1,500 or the $3,000 if you are on a family plan, then the co-insurance comes into play, meaning that the insurance pays 80% of the $49, and then you're responsible for 20%. Once the out-of-pocket maximum has been met, then at that point, you will then get covered at 100%. And as you can see here, the individual out-of-pocket maximum is $3,000 or $6,000 if you're on a family plan. Please note that that there are benefits of being able to be on this particular plan that we'll talk about a little bit later, like the health savings account. And please note that your pharmacy costs also go towards your deductible on this particular plan. There is an out-of-network benefit as well on this particular plan, but as you can see here, those amounts for your deductible and out-of-pocket and the percentage that you pay after the deductible has been met is a lot higher. So you want to make sure that you maximize your benefits, and the best option for that would be to stay in-network. We have a lot of tools to make sure that you know what the possible contracted rates would be by using a treatment cost estimator, as well as making sure that you know which doctors are in-network. Now, in the next slide, what we'll be discussing is the flexible spending accounts that go along with one or the other of these particular plans, as well as how they work. So the first thing is understanding flexible spending. What flexible spending is you choose to set a set amount of money aside, and that's tax-free. You put it into an account, whether it be the medical flexible spending account or your dependent care. What you're using it is for those services. You're using it for eligible medical, dental, vision, or dental care expenses. There is tax savings on this, and both your the IRS and your employer can limit the amount that you contribute. Primarily, it is the IRS that limits the amount that you can contribute. Now, a key thing for you to know is for 2023, you are allowed to roll over $570 from the prior year, which in this case is the year we're in, which is 2022. Please note to manage your funds accordingly, because under this account, if you don't spend that money, you will lose that money. So we want to make sure that for your medical flexible spending account, please note that you look at the balances that you currently have right now, and note that the only amount that you will be allowed to roll over into 2023 is $570. Now, in the next slide, we'll talk about the three different type of flexible spending accounts, which include a healthcare flexible spending account that help set aside money for you to use for eligible healthcare expenses. And on that, it includes like dental, vision, medical, and some over-the-counter. Now, on your dependent care FSA, that's putting money aside for dependent care expenses. So those are two different ones. And then the third one, where it's talking about the limited purpose flexible spending account, the key word on that is limited. And so what you're limited to use these funds for are dental and vision expenses. So we want to make sure you understand that there are three different types of flexible spending accounts. You would decide on which accounts you're going to participate in and how you're going to spend that money. Now, in 2023, okay, you do the amount that you're eligible to put aside, and this was posted by the IRS, is $2,850 in a healthcare flexible spending account. And as I indicated there, here are some examples of what you can use that money for on a healthcare flexible spending account. The next screen is going to show the amount that you're able to put in on a dependent care flexible spending account and the contribution limits. If you look on to the right-hand side, it says that for in 2023, you can set aside $2,500 if married and filing separately, or you can do $5,000 if a married couple filing jointly. There is no carryover allowed on a dependent care flexible spending. So please keep that in mind. On a healthcare and on a limited, you are able to carry over funds from the prior year. On a dependent care, you are not. Now, on the limited purpose, it follows the same rules when it comes to the healthcare flexible spending account. You can contribute up to $2,850 in 2023, and of course, any amount that you have for 2022 above 570 will be lost. So you want to make sure that you spend that money accordingly, because the only amount that will be able to be carried over into 2023 is 570 from the prior year. Now, on the next slide, it does provide you an example of how these cards look. And you can use these cards at a local grocery store, at your provider's office, dental provider, vision provider. A lot of them already recognize healthcare spending accounts. So you will be able to utilize this card at those particular providers. If for whatever reason you lose the card, you can call us and we'll go ahead and send you another one. If you need an extra card, we can do that as well. Or Please note that if you already have a card now, all we're doing is loading more funds in that card for this next year. And if you look at the card that you currently have now, and if it looks like it's going to be expiring within the next couple of months or so, don't worry about that. We know that it's expiring, so we will be sending you a new one to make sure that you have that for this next upcoming year. Now, on the next screen, what I'm going to go ahead and start talking about is a health savings account. Not on a health savings account, this account goes with a high deductible health plan. So on this particular account, you have to be enrolled on that high deductible health plan. So if you're planning to be on the PPO plan, you will not be able to enroll in this account because it has to be enrollment in a high deductible health plan. Very similar to the flexible spending account, where it has some tax advantages. You can also build some savings for retirement. And this account is there for when you need it. You also do get a bank card, and it works more of a bank card. And if you look, when we get to that portion, you'll see there's a difference when we're talking about a healthcare spending account versus a health savings account. Now, there are some eligibility requirements when we're talking about a health savings account. First things first, like I already mentioned, so we'll check that off. You must be enrolled in a qualifying high deductible health plan. You cannot be covered by anyone else's healthcare coverage. You cannot be enrolled in Medicare, TRICARE, or TRICARE for Life, and you cannot be claimed as a dependent on someone else's tax return if you're going to be contributing to a into a health savings account. Now, here are the contribution limits for 2023. The IRS has already posted these as well. And those are $3,850, $7,750. If you are 55 and older, please note that the IRS is allowing you to do what is called a catch-up, and it's allowing you to do an additional $1,000 from whatever the limits are for that particular year. So if you're 55 and older and you want to try to put more money into your health savings account, you can go ahead and do that. And you could do that up to $1,000 for this year. Now, on a high deductible health plan with the health savings account, there is no use it or lose it rule. And what does that mean? That means that once the money is in your account, you don't have to worry about it at the end of the year to try to spend down that money. That money will not expire. Also, there may be opportunities where your employer gives you funds for enrolling into a high deductible health plan. So the employer might be giving you money as well. And if so, that same money, similar to the money that you're putting in there, is yours to keep. So once it's in there and it's yours for you to keep. For whatever reason, if you either are retiring, if you're going to another company or anything like that, whatever money's in there is your money to keep, so you don't have to worry about the use it or lose it rule like the way you would do on a flexible spending account. Now, qualified healthcare expenses include things like doctor visits, prescriptions, eyeglasses, contacts, dental care, braces, chiropractic services. There's a lot of more. Also, there's on our website at myuhc.com, there's also something called the Optum Store that allows you to see what over-the-counter items are eligible for you to use your flexible spending account or your health savings account. So you can always go to our website and look at the Optum FSA store, and you will be able to see what items are eligible for over-the-counter. Now, as we move on to wellness, what we wanted to make sure you knew is that Dallas County is offering a wellness program in 2023, very similar to what you have now. And what we've done is just made a little bit of tweaks. So it's still going to be an activity wellness program. You'll still have to complete your health survey. So remember that at the beginning of the year, you'll want to start off with that, is completing your health survey. Then what you'll want to go ahead and do is you can go ahead and start earning points. As soon as you get your 300 points, then you'll be awarded that $300 through your employer. So please make sure you look at that, your employer information for more details on that. One of the tweaks that we've made is on the private and public challenges. And before, you would only be awarded one time that 25 points for that activity. Well, in 2023, what we are doing is anytime you enroll either in a private or public challenge and you're engaging with that and you're completing that challenge, you will be awarded 25 points for that. So if you complete 2 or 3 in that given year, then you'll be getting 25 for each one that you complete. So if I complete 3, then I'll be getting 75 points. As you complete them, you will get the points then. So once I complete one, let's say in January, if one's offered in January, I will get awarded that one in January. If I participate again in, let's say, the fall or the summer, then I will get the points once I complete that particular challenge. So that way you can get a little bit more opportunities to make sure that you get to that 300 points sooner. So please keep that in mind, and please look out for communications on those private challenges that Dallas County is going to be having in 2023. Now, as far as behavioral health, we do know that behavioral health is something very important. And what we want to make sure on this particular slide is to make sure to let you know that there are resources in the event that you are not able to see a doctor in person. Through United Healthcare, we are offering at the liveandworkwell.com site, we are able to get you resources that you can see virtually. So you can see these providers to treat things like depression, anxiety, ADD, ADHD, addiction, mental health disorders, and counseling, or even just support. Please note that there are providers that can provide you virtual services. And what we want to make sure that you know is that is available to you. And if you go to the website and follow those steps that you see on this screen, you will be able to see which providers are offering those services and schedule an appointment to be seen versus having to wait to be seen in person. So we want to make sure that you know, just like on the medical benefits, that there's virtual benefits. On behavioral health, there's also virtual benefits for you as well. Now, on the Employee Assistance Program that is also offered through United Healthcare, we want to make sure that you know that you are also eligible for some free services there. And by going to that same website, which is the liveandworkwell.com site, and entering the PEBC access code, you will be able to see what are your benefits, some online resources, things like assistance with depression, stress, anxiety, relations difficulties, even resources for financial and legal resources, things like child and elder care support, and a lot more resources. So there is definitely a lot of resources that are available online. But if you are at that point that you need to speak with someone, please note that if you're using your employee assistance program, that is at no cost to you. And all you would need to do is get an authorization code, which you will be able to access and submit for online, or you can call us directly and we can navigate that for you and make sure that you are connected with a resource for yourself. Now, as we wrap this presentation up, again, just as a reminder, I will be posting some links in the chat that you will be able to reference to be able to get additional resources like the full-on detailed presentation of this, other things about your wellness program, and some other tools like Real Appeal, which is a weight loss program that Dallas County offers to all their employees. Now, in this particular slide, what we're going to talk about is the tools that are available to you. You can always call United Healthcare directly. There is a number on the back of your ID card that you can always reference. Please note that we offer a 24/7 nurse line for you. So if it is late at night and you're not sure where you should go, or you can wait, please note that by calling the number on the back of your ID card saying nurse line, you will be connected with one of our nurses and they will assist you in directing you where you should go for that care. Some other resources that are available to you are things like the myuhc.com website, that once you register on there, you can also use the same username and password to our United Healthcare application. From those two tools, you'll be able to find providers in your area. You'll be able to see your ID card. You'll be able to order ID cards. You can also look at your account balances on your flexible spending account. You'll be able to see your health savings account balance. You'll be able to see your claims. There's a lot of tools that we're making available to you at your fingertips. We just want to make sure that you know that they're out there and that you can utilize them. Another tool for your wellness is the Rally app. That will let you know where you're at on your app, on your points for your wellness program, as well as give you some recommendations. You can also engage through the Rally coins and submit for sweepstakes and things like that. So I want to make sure that you know that those items are available. And that concludes my presentation. And please note again that if you do have any questions about any of the plans that are currently being offered to you, you can call us directly at 877-370-2849.
Thank you very, very much, Jose. I really, really appreciate that. Were you able to put that link in the chat?
Yes.
Okay,
You see
there
it?
we go. Yes, absolutely. You're good to go. And this is Kelso Ramos with Delta Dental.
Good morning, everybody. My name is Celso Ramos with Delta Dental. Today we're going to be talking about your Delta Dental PPO and DHMO plan. So we're going to talk about Delta Dental PPO first. So we got you covered with Delta Dental PPO. With the PPO Delta Dental, you visit a PPO dentist, you can save more at the most money. You can visit any licensed dentist. You won't be charged more than whatever expected to share on the bill. And you don't need an ID card to check in. We coordinated also dual coverage if you have another insurance with another partner or domestic partner with your family. So this is the PPO benefit highlight sheet. As you can see, there's a deductible per year, $150 for the family. The deductible is waived for the preventative and diagnosis. That means that you will go for a cleaning and checkup. It will be waived, so you won't even touch your max. Your maximum for the calendar year will be $2,000. As you can see, there's three types of dentists: Delta Dental PPO, Delta Dental Premier, and non-Delta dentists. You save most of the money with the PPO dentist. For the coverages, it's covered 100% on the preventative services, which is exam cleaning and x-rays. For the basic services, covers 80%. Endodontics, periodontist, oral surgery, it covers 80%. And major services such as crowns, inlays, or restorations and bridges covers 50% until you reach $2,000 per year. Implants covers 50% until you reach $2,000 per year. And for orthodontia, which is orthodontist services, it's a 12-month waiting period. It covers 50%, which is a 50% lifetime, up to the maximum of $1,750 lifetime. That means that you only can use it one time, and that's all you can do. It never resets. Pre-treatment estimate is three simple steps that we ask you to do when you go to a dentist in case you're not sure why they're charging you this amount. Number one, you can ask your dentist for an estimate. Number two, your dentist send the details to Delta Dental. And number three, you and your dentist receive a cost estimate. That's how simple it is. The cost estimator will be a budget for your dental expenses, personalized estimates. You can personalize estimates based on your benefits. Insightful, compare the cost of the same procedure, different dentists. Economical, which is choosing an in-network dentist, can help you save money. We also have a small wellness benefits online. We recommend you to check that out. With this, you can check out all your treatments, optional benefits. You can do, like, for example, a teeth cleaning, combine any 4 calendar years per contract year, periodontal maintenance, and also you can also check out what's going on at every calendar year, which it covers for the type of services that you're asking for it. We also expanded coverages. You can be diagnosed from following chronic medical conditions right here in the slides. Any questions, you can go online for this type of services. Let's go to the DHMO Delta Care USA. It's a prepaid fixed co-payment plan, which is called also the DHMO or HMO when you go to a dentist. It's available in those states on the slide. So if you have any questions, you can, go online and check out those states that they're available for that type of plan that we offer for you guys. So a comprehensive coverage, here's how it works. Once you're enrolled, it's a set of co-payments. There's no annual maximum, no deductible, no claims, and also you can do a low premiums. How does this work? It's four simple steps. Number one, Delta Dental will assign you to a primary care based on your zip code. You can make an appointment. You can visit a dentist. And number four, you pay your co-payment if there's any. Also, if that one of the things I always tell people, if we assign you to a dentist and you're not happy with them, or you want to switch to a dentist you already go to, and he's at Delta Care USA, which is the DHMO provider too, we can assign you. It will take you 30 days. So all you have to do is give us a call to the 1-800 number, or online you can switch a provider. Simple as that. You can choose your primary care dentist. Go to online dental.ins.com that I was telling you. You write down the facility number for the primary care dentist you would like, and then within the 20, receive that. But you can request it every 30 days, but we recommend you to request it by the 21st of the month, so it will be effective the first of the following month. You can submit your request at deltadentalins.com, or like I was telling you guys, by phone, call customer service at 800-422-4234. Securing your specialty in emergency care. In case there's an emergency, your primary care will refer you to a dentist. Make sure you're a primary care that are authorized and specialist service. And also you can be covered if it's out of network cover for emergencies. You have to just contact Delta Dental for plan details. What's covered with your Delta Care USA plan? Orthodontic coverage for children and adults. Also faces orthodontic treatment cover, pre and pro records, tooth extractions cover, and also cover for the in-progress treatment. For the comprehensive orthodontic treatment, your pre-post orthodontic records will be a $200 copay. Children will be $1,900 copayment, and adults will be $2,100 copayment. What this means is if you go to a dental that is a Delta Care USA plan and you want to do some orthodontics, which is the braces, this will be out of pocket with a simple case. Depends on how will be your treatment with your dentist. $1,900 will be your out of pocket. We will pay the rest. Adults will be at $2,100 copayment. And this is a comparison between both of the plans. So you can take a look at the slide. As you can see, for the PPO on the left, you can visit any license. For the Delta Care USA on the right, you must have to select a primary care dentist to receive these benefits. For the PPO, you get $2,000 annual maximum, and then a $50 deductible or $150 for the will be waived for preparing services. For the Delta Care USA, there's no annual maximum or deductibles. For the PPO dental plan, you cover services are paid based on the percentages. For the Delta Care USA, you cover services have preset co-payments. For the PPO dental plan, there's no referral needed to visit a specialist. For the Delta Care USA, you can contact your primary care dentist to coordinate your referral. And the last, for the slide, PPO dentist, Delta Dental, you visit a Delta Dental at the office with file a claim for you. You go to a non-Delta Dental, then you may have to submit that claim yourself. For the Delta Care USA DHMO, there are generally no claims forms under this plan. Find a network dentist for you plan. So we have some options. You can do that online, or we have a mobile too. For find a dentist, you just go to deltadentalins.com and click find dentist in the top menu. It's simple. You put your zip code, you refine the type of dentist that you're looking for, a distance, especially languages or spoken or standing office hours. And then you visit your dentist rated reviews of dental care. So it's basically how it works. You select your network plan, which is very important. It's the PPO plan or the Delta Care USA, and then it will show you who's in the list on the website. For the mobile app, it's free. We recommend you to stay with the mobile app all the time. When you go to a dentist, you can find also the dentist. You can cover details. You can also get your electronic ID card, and also you can sign up to get a cost estimator with this feature. And we dedicated customer service by your plan. We do have right here in the slide that phone number for the PPO, which is the 1-800-521-2651. For a DHMO Delta Care USA plan, is 1-800-422-4234. And customer service can answer general questions about your dental plans. You can speak to customer service representative Monday to Friday, a.m. to 8 p.m. Eastern time. For simple questions, you can use automatic phone system available 24/7. And if you want to go online, you can also contact us online, deltadentalins.com, to follow up any customer service or any services forms. And thank you for your time, guys. Any questions, let me know. I will be pleased to take any questions at the end of the presentation.
Thank you very much. We really appreciate that information.
Okay, are you able to see the presentation?
We are, absolutely.
Okay, great. Well, my name is Casey, and I am a senior account manager at VSP, and I handle the PEBC account. And I am just going to be going over the benefits effective January 1st, 2023. Now, there really aren't any major changes. They're just VSP has rebranded. So we have a new logo, and then we've also changed the name from Primary Eye Care to Essential Medical Eye Care, which I will be explaining later in the presentation. So why VSP? Well, at VSP, we want you to see well and be well. So we're a health-focused company, and your well-being is at the core of everything we do. Eye care is essential to your overall health. So at VSP, we do think of it as a preventive benefit where you can go in and get an eye exam and kind of get a first look at some of the health issues that you may be facing that will help you be able to go to your primary care doctor as early as possible. So early detection is really what we try to promote at VSP. And for savings with VSP, you can rely on additional savings and offers to get the care you need and with low out-of-pocket costs. And then for access, we have a huge network. So private practice doctors, retail locations, and also you can go to our website to find any provider that you would be interested in seeing to see if they're listed in our network. We have a huge network, and you also have out-of-network benefits. So the in-network VSP plan is a VSP Advantage plan. You have an exam every year with a $10 copay, and it is on a calendar year. So all of the benefits refresh every January 1st. So if you haven't used your benefits, say this year, you could actually go in December, even on December 31st, and use your benefits, and then the next day on January 1st, use your benefits again. So just so that you know what a calendar year benefit means. The frame allowance is $200. It's actually $250 if you buy your frame at VisionWorks. The lenses are single vision, lined bifocal, and lined trifocal with a $20 copay. Children are covered for polycarbonate lenses. Standard progressive lenses are covered in full. And there's a discount on any lens enhancements that you choose to add, such as scratch resistant, UV, or anti-reflective coating. Your contact lens allowance is $200. There is a $40 fitting and evaluation fee, but after you pay that copay, you have the $200 allowance to go toward your contact lens materials. And then again, I was talking about how we used to have a program called Primary Eye Care. It is exactly the same, except now it's called Essential Medical Eye Care. This kind of came up during COVID because we wanted to be able to have you go to your VSP doctor instead of going to an ER or going to your doctor's office, which were kind of overrun and some of them weren't even open. If you had any kind of eye issue, like a scratch on your eye or an eye injury or pink eye or something like that. So it would be an appointment that you could make to get treatment for any kind of eye conditions instead of going to the ER or your doctor. And then there's a retinal screening, which would be available for members with diabetes under this plan. And the retinal screening for members without diabetes is also important, and I'll talk about that a little bit more on a couple of slides from now. It's no more than a $39 copay for a routine retinal screening, which is an enhancement to the Well Vision exam, which was the $10 copay. And then there's 40% savings on additional pairs of prescription glasses. And then again, you do have out-of-network coverage, which is a schedule of allowances that you would pay for out of pocket and submit to VSP, and then you would get reimbursed up to the maximum schedule of allowances. So the retinal imaging, again, this is really important because this gives your doctor an even deeper look into your eye to try to detect those diseases for early detection. So it actually helps them be able to detect conditions such as glaucoma, diabetes, and macular degeneration. And again, finding those disorders early is really critical to preventing serious disease progression and vision loss. So again, that's a $39 copay for the retinal screening. Members with diabetes have it fully covered. And then again, Essential Medical Eye Care is just being able to call your VSP network doctor if you're having an issue with your eye instead of going into your regular doctor or the emergency room. And then regarding our network, again, we've got a premier provider program where you get extra exclusive bonus offers and savings. And they carry our widest selection of featured frame brands. And they all have the advanced eye exam technology like the retinal exams that I was talking about. On our website, if you're searching for a provider, you'll be able to see that they have the VSP Premier Program banner. And then it's really important to register as a member on our website. So you can go to vsp.com and create an account, and you'll be able to view all of your current benefits and see the benefits that you've used. You have access to be able to find our customer service phone number, website. You don't need an ID card to visit a VSP provider, but if you prefer to carry a card, you can print a card from the website once you've logged in. But really, you don't need to have a card. You can just tell your VSP provider that you have VSP, and they will take it from there. And then our exclusive member extras, if you go to our website, you can find some additional offers, just such as some of our promotions that we have on frames, like an additional $20 off or an additional $40 off. If you go in and create the account and register and keep track of it, if you know you're going in for your appointment and you know that you want a certain brand of frame, you can go check to see if there's promotions and then take advantage of those extra discounts by going to the website and checking for those. We've also got a lot of other special offers that are included just for being a VSP member. Iconic is our online eyewear store, and I've actually used this several times. It's really easy. You can integrate your benefits. So you would just log in and be able to put in your information, and you can actually use your allowances toward eyeglasses or contacts. So, and they have a great return policy. So if you're nervous about, shopping online for glasses, it's a very easy and quick return policy. But if you want to shop online for your glasses, this is a great place, and you can just use your benefits right then and there. So you can connect your vision insurance, select the product, you would upload your prescription, and then they ship you your glasses. And they've got a great selection too. And then this is a great member value add for VSP members, True Hearing. So a lot of people are having issues with their hearing, and their parents are having issues with their hearing. And the great thing about this is that it's not just for VSP members. VSP members can allow their family and friends to use this discount. So if you have a parent that's struggling with hearing and you're a VSP member and they might not necessarily be covered by VSP, they can still use this discount. And and hearing aids are extremely expensive, so it's a really great value add as a VSP member. So you can save up to 60% on a pair of hearing aids with True Hearing. And I've got the website here, truehearing.com/VSP, if you're interested in that. And I just want to thank you for allowing me to present today. Thank you for your time.
Thank you so much, Casey. We appreciate that.
All righty. So again, let me just start by saying I apologize for the inconveniences. My name is Zoltan Katona. I am the Senior Account Manager with CVS Caremark and have been for about 20 years. PEBC and Delta County and Dallas County and Tarrant County, all these clients came aboard with us in 2020, and so I'm glad to be talking to Dallas County today, and I hope everything's going well for everyone. We don't have any earth-shattering announcements or anything like that. Your plan, at least from our perspective, has been extremely stable. There's been absolutely no changes really since you came aboard in 2020. So just want to point out a few little things today. If you go to the next slide, we are your prescription provider. We have approximately 70,000 in-network pharmacies around the country, it's going to be difficult for you to find a pharmacy that's not in our network. We also have minute clinics at many of our pharmacies, not all, but quite a few. You can get tested for strep throat and a lot of simple medical things that you might not want to go to your doctor and incur a big charge for. So that's an economical way to have you get some treatment and or your child, and for more simple conditions anyway. CVS Health Hub, we're becoming more of a health company rather than just prescriptions. So we're kind of positioning ourselves as a health destination, really, in many respects. Next slide, please. So again, this is a little bit repetitive. We do manage your prescription benefit. We do work with UMR to coordinate different coverages, sometimes for infusions and specialty things like that. You do have to run those kind of drugs through your medical provider. Unfortunately, a lot of infusion centers won't accept the drug from an outside vendor, so they kind of protect their profit margin that way. So in those cases, UMR would be the one to pay for that kind of service. We do work with Dallas County as far as trying to modify the formularies. Every year formularies change. They typically get reviewed quarterly. If a new generic has come out, the brand will probably remain covered for the first few months, and then as the generic price drops and it gains acceptance, then we tend to lock out the brand name. And this is done to preserve savings for both you as the member and Dallas County as your insurance coverage. So that's our main focus, is we want you to get all the medications you need at the best prices possible. And then that's what we're tasked to do, is keep the prices low as much as possible. We'll talk a little bit more about the tools and services as we move along here. Next slide, please. Okay, so as everyone else has mentioned, we do have caremark.com. It's a great site for you as a user to manage your prescription benefits. There's so much information there. It gives you your plan details, your costs. There's a place where you can, if let's say you're prescribed a new drug, you can go onto caremark.com. You do need to register as a user, and that's how it knows your plan specifics. So once you get registered, you can check medication costs. Let's say that your doctor prescribes you a new drug for you, and you can go onto the site, search for the name. I recommend always trying to price a 30-day supply. Even though you are allowed to fill 90-day supplies for maintenance drugs, it's always good to just check for a 30-day supply. You run into less complications that way. And it does actually allow you to even choose the pharmacy you want to fill at and see what the price is there. So it's very specific. More often than not, it's going to be quite close, if not exact, although we do say that it's an estimate. But more often than not, it's right on the money. So You can also find an in-network pharmacy there. You can look up by mileage or zip code or town, wherever you may be if you're not in your home area. Like I said, it's going to be difficult to find a pharmacy that is not in-network. So most anywhere you go, as long as you present your ID card, you will receive the appropriate discounts that you're entitled to. And while we're on that subject, let me mention this. A lot of times people will tell you that if you don't have your ID card with you, or you're at a strange pharmacy, to just go ahead and pay out of pocket and then send in a paper claim. You can, in fact, do that, but I never recommend it. Paper claims should always be a last resort. What happens is when you purchase a prescription using your identification, they process that claim through our computers. So that claim instantly comes to us. We price the claim and return it to them. So you get the lowest price possible that way. Unfortunately, if you go into a pharmacy and don't present an ID card or don't use insurance, then they will charge you what is known as usual and customary. And it's the equivalent of a list price. It's the highest cost possible, basically. So the unfortunate part is once you pay that, you send in your paper claim, we're going to reimburse you based on the contracted rate, not what you paid. So you may pay $100 for a $20 drug, but we're only going to reimburse you based on the contracted rate. That's why Dallas County contracts us to save them money. So it's in your best interest not to use, not to forego your insurance. There are exceptions. There may be times when you'll find that you see the commercials for Good RX and stuff like that. So if maybe you don't have your ID card, try to use Good RX or one of those things, at least save you a little money that unfortunately you may not get back all of it. But you can always call in, try to get your ID number. You can call in the Dallas County HR and get your ID number. You can try to use your social. All of those things can work, and even if you do have to finally pay out of pocket the high price, if you're close to home, you can get your ID card and go back to the pharmacy and have them process it and get your full reimbursement. So that's always one thing to keep note of. We do provide mail order service where they deliver right to your home. There's never a cost for postage, anything like that, unless you request an overnight delivery or something like that. But it's always free. I tell people that, unless it's a convenience to you, you don't have to use mail order. A lot of people don't like to get out, especially in, with the last couple of years of the pandemic. People were hesitant to leave their homes, so they can ship it right to your home. They do use freeze packs if the medication needs to be kept cool. They use insulated packages when necessary. So, but if mail order is not your cup of tea, that's fine. You can just call your pharmacy like you always do, and again, remember you are allowed to fill 90-day supplies on your maintenance medications. So, again, that's less time you have to spend chasing your prescriptions. Also online, you can view a history of your prescriptions. If the prescription is valid still, they do expire after 1 year. It'll tell you your renewal date, when you can refill. It'll tell you if your doctor needs to be called for a new prescription, they can do that for you. And if you can actually dig in deeper in there to see all the prescriptions you've ever filled through your Caremark coverage. It does allow you to print out an EOB or a list of your expenses if you need it for tax purposes, anything like that. They have so much functionality on there. I don't have time to tell you about it all, but a lot of analytical tools, a lot of information about disease states, that sort of thing. It does show you your deductible or out of pocket. Of course, if you have a PPO plan, there's no deductible, but everybody has an out of pocket these days, so it's always good to keep track of your status there. And it also allows you to set alerts and reminders for various things. You can choose to opt in to accept messages from Caremark. We'll send you reminders or when it's time to refill, or if there's a shortage of something, or any kind of announcement that might affect you personally. So I recommend that everybody register on caremark.com. It's kind of like customer service that you can drive yourself, and it's easily very intuitive and functional, and it's just a big convenience for you. So I totally recommend it. One note: if you have a PPO 1 year and then switch to the high deductible next year, or switch either direction, it will require you to re-register if you change plans, and that's so it still knows what your plan is. It can connect your plan with you. So lots to explore there, and I certainly recommend it. We also have a CVS.com app so you can deal directly with your retail side. Next slide, please. So I think I've covered most of this actually. Registering at caremark.com. It's very simple. If you're a new member for 2023, it will require you to wait until January 1st and when your eligibility is active before you can register. But you can certainly scroll around in there in the meantime as a general user. So next slide, please. Thank you. Nothing new here. I always say that no changes are great. They add stability. I joke with people that I know everything there is to know about your plan, but I know almost nothing about my own. And that's quite true. I work with your plan daily, so it's very familiar to me. It's a simple plan too, so it's not very complicated on your end, at least from our perspective on the pharmacy side. So Dallas County came aboard with us in 2020, and since then there have really been no prescription changes other than the normal formulary adjustments that occur quarterly. The reason for those are, new drugs are introduced into the market. They have to have a tier placement. So our formulary review committee, which is comprised of outside doctors and pharmacists, compile our formularies on your behalf, basically. And they take into consideration anything new that's occurred or anything in the pipeline. This year, we don't see a lot of new generics in the pipeline that are earth-shattering. We've had a few really big ones in the last year, like Humira and a few other things coming up. So obviously, generics are always your best bet. Like I say, really, there's no changes to your copays, your deductibles, your out-of-pockets. On the pharmacy side, all remains the same. Nothing new as such to learn. So nothing's changing in that perspective. So next slide, please. Okay, these are all terms that I I think you're probably familiar with, is the deductible. That's typically the amount you have to pay out of pocket before the actual copays kick in. As we already know, the PPO doesn't have a deductible, whereas the high deductible plan by nature does. So once you meet your deductible, then your copays kick in, and that's the percentage that you pay out of pocket while the plan picks up typically the majority. The maximum out of pocket, as you know, is set by law and the plan. And once you reach that amount, everything becomes no charge on your end. We do coordinate with UMR, so these out-of-pocket amounts do accumulate together. We communicate daily. Pharmacy transactions are given to UMR instantly as they occur at the pharmacy, and medical transactions are provided to us by UMR daily. So we do share those and accumulate them together. So, you know, whether you're paying your doctor or a hospital bill or your prescriptions, that will accumulate all to your out of pocket, so you can get that satisfied and start enjoying benefits for no cost if you happen to have that much need for medical use that year. Sometimes people don't get sick or have to take medications or go to the doctor very often, and then they sometimes feel cheated that they're not getting their money's worth out of their benefits. But I think you're more blessed to have good health. As we already know, generic medication is always your best option. The government, the FDA, does have what's called an AB rating. So what they're saying is that the generic is every way functionally equivalent to the brand name product. And there's usually very extreme savings comparing generics to brand medications. There are exceptions. Sometimes, for instance, now we're in a kind of a strange place where there are some ADD drugs that we're dispensing the brand, but giving you the generic copay. Pharmacies are aware of these programs. They're called a DAW9. So they know which drugs are like that. They'll dispense the brand to you, but charge you for the generic. So you don't have to worry about it. The pharmacies know when that applies. Preferred brand is obviously if there's no generic, there's usually 17 years patent protection for brand drugs. After 17 years, other manufacturers are free to manufacture the same drug under a generic name. And then there's lots of competition typically, and drives the price of the generic down very quickly. Then there's non-preferred medications. Those are the ones where there's multiple brands that do the same thing typically. One will be preferred, and then the rest non-preferred, and that is done because we can negotiate with manufacturers, and we'll typically do that and lock in one manufacturer that provides us the best price and discount, so you can pay the least amount if you have to use that drug. We obviously want to avoid non-preferred brand drugs whenever possible, as they're going to be the highest cost, unfortunately. Preventative medications, as Jose mentioned, also on the medical side, there's the Affordable Care Act. We've gotten away from calling it Obamacare now, I think, pretty much. But the Affordable Care Act, healthcare reform, continues to grow and change. You know, everybody's benefited from the free COVID tests and the free vaccinations. And so the Affordable Care Act provides a lot of medications at no cost. Contraceptives or generic contraceptives are typically free. Even brands without generics are free. All the flu vaccines, shingles, pneumonia, all of those are typically free. They do provide high blood pressure drugs for the most common strengths in generic are free. A lot of the diabetic generic drugs are free. So there's a lot of good things that have come from the Affordable Care Act, and it continues to grow and change over time slowly. You know, when they say we're fighting for lower drug costs, that's how they affect it through the Affordable Care Act. They're talking about limiting the cost of insulin and that sort of thing. So those are all things that are done through the Affordable Care Act and ultimately benefit you as a user. So they are the only change I can think of there this year is they're apparently going to eliminate the small dose aspirin, which was covered with prescription previously, and I think they may eliminate that this year. So you'll hear about those as they're announced on the news typically. So next slide, please. And as we continue with terms, these things sometimes will frustrate you, but they're done for logical reasons. Quantity limits. I'll point out some drugs that what we call them QVT drugs, quantity versus time. And those are typically drugs like, well, opioids will fall into that. They have strict limits nowadays. Migraine drugs are very commonly in that category. People are very adamant about getting their migraine drugs, but they don't typically know that they're not meant to be taken daily. These kind of drugs are not designed for long-term everyday use. So some of those migraine drugs might be limited to 9 pills per 25 days. For whatever reason, QVT drugs are always limited either to 25-day supply or 75-day supply. And they differ from normal regular drugs in that most regular drugs you can refill after you've used 75% of your prescription. So QVT drugs don't work that way. You have to wait the full 25 days to refill. So if you try to, let's say you fill 9 pills, which is the limit for that particular drug, you do have to wait the full 25 days to fill 9 more. If you only filled 3 more after the 25 days, then within the next 25 days, you can only fill 6. So it's a cumulative, and it can lend to confusion sometimes, but you'll typically be told when it's a QVT drug, so you can work with that and work with your doctor. Step therapy, that's one of those things where we require you to try 2 generic drugs typically before being approved for a brand drug. Doesn't apply to everything, but there are many drugs that have generics available, and we want you to try those first. And that's how we drive savings for Dallas County and for you. So that's what we mean by step therapy. Prior authorizations are always available to you. If a drug is excluded for, as I say, a non-preferred, it can get locked out over the preferred drug. The prior authorization can sometimes allow you to have your doctor send in a letter of medical necessity and then get approved for that drug. You know, maybe they don't want to change the therapy, or, you know, there's a lot of clinical reasons they might not want to try a different drug. So the system does look in your history for those prerequisite drugs. If it doesn't see them, it will reject and ask you to get a PA if you want to stay on that same drug, or it will tell you what prerequisites it wants you to try. Dispenses written is what we call DAW. It's your product selection code. Basically, it means your doctor has the right to write you a prescription and allow generic substitution. You know, doctors mostly know when generics are available or not, and they have their own preferences sometimes. You know, a doctor may note your prescription that brand do not substitute, basically. When they do that, that's a DAW1. It means your doctor will not allow a substitution of a generic. As a member, you also have that right. So let's say they dispense a generic for you. You can refuse the generic and say, I want the brand. That's called a DAW2, and oftentimes you're penalized for that. You might pay the generic cost plus the difference between the brand. So I recommend you avoid the brand names whenever possible. Again, drives that savings. I personally have never had a problem with a generic. Some people are, a lot of times you'll find older people like myself that believe, you know, the brand is better, and that's not really the truth. They are the same ingredients, the same FDA approvals. The only difference in generics typically is if it's the color, it could be the coloring. It might be the binding agents, and, you know, that hold the chemical components together. I always joke around, and, you know, unless you're the boy in the bubble, the generic is probably going to give you the exact same results as the brand. So I definitely recommend you always give that generic a try. And then appeals. You know, if your prior authorization is denied, you do have the right to an appeal, where what your doctor submitted and test results and that sort of thing, and why they'll explain their logic of why they've prescribed you this drug. And, you know, that gets reviewed and maybe overturned on appeal. So generally, I assume you're going to be fairly familiar with these terms, and we're always glad to explain them again as it comes up. Again, here's a reminder to check your drug costs and coverage at caremark.com. It'll tell you what tier the drug is. It'll if it's a brand with a generic available, it will also tell you the generic, you know, and give you a comparison of costs. So we've already talked about non-network pharmacies. Avoid them if possible, but, you know, if you have to use one, go ahead, but just understand that unless you can return to that pharmacy with your information, you may not be reimbursed the full amount you had to pay. So just try to avoid non-network pharmacies, and you know, as I said, even if you don't have your ID card, you can give them your social and they'll typically be able to find you. So next slide, please. All right, so this is just a review of your co-pays. As we've already determined, they are not changing next year. Everything remains the same. So PPO plan, obviously you can see there is a benefit to getting a 90-day fill of your maintenance medications. Those are your high blood pressure, your diabetic oral medications, cholesterol medications, that sort of thing. So there is savings. I mean, you're going to get a 3-month supply for 2 months cost, basically. The high deductible plan's a little bit different. It's 20% straight across the board, really. So, but once you meet that out of pocket, you got it made. All right, next slide. And a lot of these are a little bit redundant. We've already discussed the 90-day supplies that are available to you, and I certainly recommend them. I don't like going to the pharmacy. I don't like waiting in line, even in the drive-through. A lot of times I'll send my son to pick my prescriptions up, but anyway, Retail 90 is a great thing. You're not limited to CVS. Please know that. Many people think that for some reason that because CVS Caremark is your prescription provider, that you do have to go to CVS stores, and that's not true. We certainly want you to. We'd love you to. We want to give you the best service possible, and we believe we can do that better than Walgreens or the others. But you're certainly welcome. A lot of people have a relationship with their pharmacist. They understand what your conditions are and what you use monthly, and they actually care. So if you have that relationship at Walgreens or your local Walmart or mom and pop shop, that's fine. Keep going to them. Just use your ID card. Next slide, please. This is another redundant one here. As you already know, you'll pay on the PPO. You pay 100% of the prescription up to the amount of the cost of the drug until your deductible is met. And once that's met, you enjoy your co-pays from there. Of course, once you meet your out-of-pocket on both plans, you pay zero. So it's always good if you can do that. It's also good if you don't spend a lot of money on this type of thing. That's to your benefit too. So either way. And next slide. Okay, and we've already talked about the Affordable Care Act. Oh, I wanted to also mention, I didn't mention the smoking cessation products. That's a good one. 10 years ago or so, I was able to quit smoking through using Chantix. A lot of people are trying to quit smoking. It's just the way of the world now. We all know that it's no good for you. So Chantix, for instance, has been associated with a lot of side effects: bad dreams, terrible sleeping, extremely vivid dreams. I was fortunate. I didn't have much of that. I slept very poorly, but it worked so good that I can't begin to tell you. So the government allows us now 168-day supply of smoking cessation products. So even if you got them last year and you weren't successful for whatever reason, try again this year. The first 168 days of products are free. So whether it's the gum or the patch or Chantix, I think they have other ones now, lollipops and various different methodology. Whatever works for you is what we recommend. And again, you've got 168 days worth of products at your disposal at no cost. So that's a great thing. Sorry about that. Next slide, please. And by the way, those are at no cost, despite your deductible status. So even if you have not met your deductible, whatever ACA covers, whether it's the cholesterol drug or high blood pressure or any of that, you still pay zero for those generics, those covered generics, despite your deductible status. So we talked about vaccines. You can walk into a CVS and say, hey, can I get a flu shot, please? They have every year they have a new formulation for the flu shot, as you probably know. Seniors like myself, they have a they call it a quad shot. It's a little bit more powerful for us older folks. Pneumonia vaccinations for people over 65. Shingles, I think, is over 50 or 55. A lot of people are touchy about vaccinations. I personally recommend you get them all. I believe in them. I think the industry has proved that they're valuable and do a good job. So my recommendation is try to get everyone available to you. I've never had shingles, but I heard it's horrible. I've had lots of friends that have had it. I know I don't want it. So they did come out with a new shingles formulary last year that's even more effective. So I totally recommend it. And that is an option for you. So even vaccinations for your children are available at no cost to you at CVS. So definitely recommend those. Next, please. And that brings us to the end. I'm sorry I didn't have anything earth-shattering to tell you about, but I hope this helps a little bit. We are here for you 24/7. You can always call in your customer care person at Caremark, and they can help you with whatever your need may be. You can place your orders through them for mail, or you can do it online yourself, like I said. They're there to answer your questions. If they can't answer your questions, I will. So your plan knows to come to me if they need anything outside of the norm, and I'm always here to help you for that. So we appreciate your business a great deal. We value your health as much as you do, and we encourage you to keep up your healthy habits. Thanks for your time today.
Okay, do you see my screen?
Absolutely, we do.
All right, perfect. Well, hello everyone. I'm Lori with the Hartford, and I'm just going to be reviewing the life insurance options you have for your open enrollment today. What is life insurance? It's a lump sum benefit that's paid to your beneficiaries, to help pay for things like your burial, your final expenses, any debts you may have, like student loans or car loans, or even your mortgages. It's also there to help with future expenses, maybe tuition for your children, rent, childcare, retirement savings, and maybe even elderly parent care. So life insurance can't fill your shoes, but it is a comforting source of income and support for your family if you can't be there. So even the most basic things in life are not guaranteed, such as the income you depend on, the roof over your head, plans for the future. And a question to ask yourself is, if you die unexpectedly, will those advantages in for your loved ones? So that's something to think about with life insurance. And then some other advantages of life insurance for the Hartford include affordable group rates. There are premiums that are automatically deducted from your paycheck. Portability is included, and this option lets you keep your life insurance plan if you decide to leave your employer. Conversion is also available, which allows you to convert your coverage to an individual plan if you leave. There'd be a cost change at the time of that conversion, but you would not be required to undergo medical underwriting. And then there's also a living benefit option that's available. So if you're diagnosed with a terminal illness with a 12-month or less life expectancy, that lets you receive an accelerated payment of up to 80% of your life insurance benefit to do with what you please, and then the remaining benefit would be paid to your beneficiaries upon your passing. So now let's look at your life insurance options. So how much basic life insurance is provided by my employer? So you're provided with 1 times your basic annual earnings up to $50,000. There are age reductions, so it would reduce to 65% of that coverage at age 70, 40% at age 75, and so on. That would be if you were still working at these ages. The living benefit option is available also, again, which means, again, if you're diagnosed with a terminal illness and you have 12 months or less to live, you can have 80% of that amount accelerated to you to do with what you choose. So I'm not really sure where we were, but just basically one time your salary, sorry about that, is provided to you at no cost, or the age reductions, the living benefit option of that 12-month life expectancy, less, then you can have 80% of that fronted to you to do with what you choose. And then the conversion and the portability options are included. How much additional life insurance coverage can you purchase? So you can elect half of your salary, 1 time or 2 times your salary, in addition to your employer paid life insurance, up to a maximum of $400,000. And if you wish to elect coverage for the first time, meaning you've declined in the past, or you want to increase your coverage during this annual open enrollment, evidence of insurability would be required. This is not applicable to the new hire selecting benefits for the first time during the new hire enrollment, but if you've passed on this or declined this coverage or chose not to elect in the past and you want to get in now, then evidence of insurability would be required for that, or if you want to increase. Note again, on the voluntary life insurance, there are age reductions, and the living benefit option is included with that too. And then there is portability available with the voluntary life insurance. However, there's a maximum of $250,000 combined that you can port with your basic and optional life that you can do that with. The next slide, please. How much optional life insurance can I purchase on my eligible dependents? Well, you have 2 options. There's option 1, which is $5,000 on your spouse and $2,500 on each dependent child. And then there's option 2, which is $10,000 on your spouse and $5,000 on each dependent child. Now note that the dependent children are eligible and covered to age 26. And then you can also purchase additional life insurance on your spouse. You can purchase in increments of $10,000, $25,000, $50,000, $75,000, or $100,000. Now, if you wish to elect spouse coverage for the first time or increase that coverage during this annual open enrollment, that evidence of insurability would be required. Note that the spouse life insurance cannot exceed 50% of the employee's life insurance, their total life insurance. And if you do elect the spouse life insurance, you can still elect those optional coverages, which is that option 1 or option 2 coverage to cover your spouse and children. So you can elect, if you elect life insurance on yourself, you can also elect that option 1 and option 2. And then you can also elect that spousal coverage if you want to. So you can do both of those. However, if you choose not to elect the voluntary coverage on yourself, you cannot elect that spousal coverage, that optional spousal coverage, but you can still do option 1 or option 2 with that. And then conversion and portability are both available with the voluntary life insurance. And next slide, please. Just a quick note on the evidence of insurability. Why would you need it? You would need it if you did not elect the optional life or spouse life as a new hire during the new hire enrollment period, and you're choosing now to elect it for yourself and your spouse during this annual open enrollment, or if you decided to increase that optional life on you or your spouse. And just real quickly, what to expect if the evidence of insurability is needed. You would receive notification by mail or email, and then it would direct you to a website link with your user ID and password. And then it would ask you to complete the medical questions on the site or download and print a copy of that application, and you can mail it back to us. Next slide, please. So here's an example of how the life insurance benefit could work. Keith died at age 48 due to heart failure. He left behind 3 children and a wife. Melissa, who commuted over an hour a day to get to her job. Keith's life insurance helped pay off the remainder of the mortgage on their family home, and also allowed for Melissa to stay at home and help her 2 younger children, get through the period, and also still provide for her college-bound daughter. So it's just, they're planning, the life insurance is there to help for pre-planning and, goals you may have set for you and your family. On the next slide here is really important, is keeping your beneficiaries updated, is easy with a Hartford. You can add or change your beneficiary at any time. There is an accessible customer service help available by calling this 855-396-7655 number. There is a website with access 24/7, which is available all year. And to make changes online, you can visit this website right here. You would enter your ID, which is your initials in lowercase, and the last 4 digits of your social security number. And then your password would be your initials lowercase and your full date of birth. And then you would click on the login to start the process. Now, it's really important to remember keeping your beneficiaries updated is very critical. We always tell everybody to check your beneficiaries every year. And if you do have a life event change, like a marriage, divorce or birth of a child, to please go in and make sure you update everything then there also, because anything who's ever listed on that will be your beneficiaries, even if you meant to change it and you forgot. So that's important to do that. And just a quick note, Texas is a community property state. So to assign someone other than your legal spouse, if you are married, you would need to have them sign a spousal consent form to do so. On the next slide here, again, we're trying to encourage everyone to update their beneficiaries prior to January 1st, 2023, because if no beneficiary is named, or if no named beneficiary survives you, the Hartford will pay the executors or the administrators of your estate, or the money could all go to your surviving spouse. Or if your spouse does not survive you, it will pay in equal shares to your surviving children. And then if no child survives, it would pay equal shares to your surviving parents. So there will be a delay in payment if no beneficiary is named. So it's just really important. We're just trying to stress that please go in and update your beneficiaries. These next few slides here, I'm going to go over them pretty quickly here, but it's just, they'll show you how to add, change, or remove your existing beneficiaries. So you'll go onto the site here, the Ben Select application website address, which is shown here. And then you can do that to add, change, or remove beneficiaries. You'll enter your ID, which is your initials, lowercase, and the last 4 digits of your social security number. And then your password, again, will be your initials in lowercase and your full date of birth. And then you'll click on the login process to start. On the next slide here, you will see the welcome screen. And this is the welcome page, and you can confirm your coverage amounts and your premium costs here. And just note, sometimes the dependent life elections may not show up on the screen, but the beneficiary for all your dependent life insurance, your spouse and your children, is always you, the employee. On the next slide here, you will see where you can select the plan to update or add a beneficiary. And you can review your existing beneficiaries and update, add, or delete by checking on the plan. So you click on that plan that you want to review. And then on the next slide, it'll just say updating the beneficiaries. So you'll click the plus sign to add a new beneficiary, or hit that pencil next to the beneficiary name to edit the information. And once you do that, you just click next. And then you'll complete the beneficiary demographic information here. And then after entering that, you just want to make sure you hit save to continue the process. And then once all your beneficiary information has been added, you'll be returned to the beneficiary screen, and then you'll click next. And then here you'll sign and submit. You'll see your coverages, the forms that will need to be signed before completing the process. And then you just hit complete again to hit the process on that. And then on the next slide shows the final step to confirm and authorize the changes. The confirmation, list all the beneficiaries for each coverage. It is in Adobe format, so you can print it out and save it for your records. And then you click sign form to complete the process, and then you can log out of the site. So these next few slides here our services that are available from the Hartford. As a covered employee, you have access to the Hartford Life Essentials, which provides you with a wide variety of services at no additional cost. And they can help right now while you're actively at work. There's travel assistance and identity theft protection, estate guidance and will prep, funeral concierge, and then there's the beneficiary assist. On the next slide, the first one we're going to talk about real quickly is our travel assistance program and identity theft services. Travel assistance, it's a great resource to know that you have. It's if you're traveling for business or pleasure, you just have to be 100 miles away from home for 90 days or less. And it's for you, the employee, your spouse, your dependent children under age 26. So everyone can use this plan. So if you have kids away at school or you're going on vacation or you're traveling from work, but it includes things like emergency medical assistance, if you need a referral to a doctor, if you needed to be evacuated, if you needed medication, you forgot your medication, or you needed help, you lost your glasses, you needed to get a hold of your eye doctor. They do all the work for you. There's also emergency personal services. If you need help, getting cash, you lost your wallet, you need legal assistance. Even if you want pre-trip information, it's available for you. The identity theft also has protection for you at home or away. There's prevention education information, detection support, card replacement help if you were to lose your credit cards or your driver's license. So here's an 800 number right here. It's the 800-243-6108. You can call or you can go on to the website assist@imglobal.com. There's also a number there if you're out of the country also that you can contact. The next slide here is our estate guidance and will preparation. So, keeping your will updated is another important thing you can do for your family. If you do not have a will or you need to update your will, the Hartford's Estate Guidance Will Prep Service will help. So it is a simple online will preparation. It's licensed attorneys that provide legal support via email. It's unlimited, no cost revisions. And then there's additional estate planning services available for purchase. So this will prep is, at no cost to you. It's a great resource to have. So if you don't have a will, we really encourage everyone to look into this. It's just really important that you enter this code that's right here, the WILLHLF code. You enter this code when using the service, and that way you would not be billed for that. So this is just another great resource to remember that you have. The next one on the next slide here is going to be our funeral concierge services. And this is support available 24/7, 365 days a year. It helps with pre-planning and preservation of final wishes, beneficiary support with funeral arrangements and pricing comparisons if they want help. Again, there's a site you can go to or a number you can call, which is at 866-854-5429, or you can visit our website at the everettfuneral.com/Hartford. And there's a code in there too that you can put in there, that HFEVLC. If you put that code in there, that'll put you right where you need to be. And it's just another great resource to help you if you need any help planning a funeral, if your beneficiaries need any support or counseling with that. And the last slide is our beneficiary assist. And this is another great resource that's available to you. It's financial, legal, emotional support. And it includes a total of 5 sessions or equivalent of professional time for your beneficiaries. Their support services can be used in combination or all for one specific service. So it could be 3 emotional, 2 legal, or all 5 of them could be emotional visits, but these are available to you and a part of your plan. And again, these are all great resources available to you through the Hartford. And that is the conclusion of the presentation and all the information I have today for you with the Hartford. And thank you for your time today.
Well, thank you. My name is Akila Scales Miller. I'm with Colonial Life. I'm your account representative with Colonial, and we've partnered with Dallas County to provide your voluntary benefits. My agenda today, I'm going to share who is Colonial Life, what are the voluntary benefits that are available to Dallas County employees, and make sure that you guys are aware of the ways that you can sign up. And I'll touch a little bit on claims. We've been in Dallas County now for almost 5 years, so quite a few employees have various policies, and we have a streamlined claims process. So I'll put in the chat some important things that I think the employees should be aware of. We'll give you a way to have access to the benefit administration site called Employee Navigator, and remind you that the company code that specifically applies to Dallas County is DCTG. That is a way to view if you already have existing benefits. You can go into Employee Navigator and look at those existing benefits. This will be live as of October 1st. And then also if, well, it's live now for existing benefits, but it'll be live for making elections for 2023 as of October 1st. If you are a person that does not have current coverages with us, I will also talk about ways that you will be able to register so that you can self-enroll if you feel you would like to do it yourself. I also will provide a scheduler so that if you want to schedule some one-on-one time with a benefit counselor, you will be able to do that as well. So we always say keep unexpecting. Colonial Life provides benefits for life's unexpected moments, including accident, illness, and injury. If you were injured and couldn't work, would you be okay financially? Most people would need a little help if something happened. And then you have to ask yourself for how long. Who would pay for funeral costs if the worst were to happen? So those are questions that we all have to ask ourselves if we're trying to make sure that we are financially okay. Little quick fact, we found in the Federal Reserve released a study that 40% of American adults wouldn't be able to cover a $400 emergency with cash or savings or a credit card charge that they could quickly pay off. About 27% of those surveyed would need to borrow the money actually or sell something to come up with $400. An additional 12% would not be able to cover it at all. So because of that, there was a need to partner with a company that could give you some resources that could assist if something happened. So who we are, we were founded in 1939 with the all-female sales force, and we've been protecting families, finance, and futures for over 80 years. So we've partnered with over 100,000 businesses, and we protect over almost 5 million employees across the country, and we are part of a Fortune 500 enterprise. So we've been awarded the #1 spot by Newsweek as #1 in customer service since 2019, and we try to bring that to Dallas County as well. So we also bring an unexpected approach to employee benefits. We're committed to providing critical financial support when you need it most. I think I'm proud to say that we shined brightest during COVID recently when a lot of employees had unique needs. We honored what we said, especially in the area of short-term disability, and a lot of our programs, because we design, market, handle all of our insurance products at one location. We don't outsource. We were able to pivot pretty quickly to make sure that we could be prepared for the unexpected things that happened with COVID. Our solutions are tailored to your needs and evolve with you as your life changes. We work hard to make filing a claim and managing your account online very simple, and we're available to support or answer your coverage questions locally and at our home office in Columbia, South Carolina. So voluntary benefits, let's talk a little bit about what those are. So voluntary benefits can help fill the gaps in your medical and other insurance. I would be remiss if I didn't say that Dallas County has excellent benefit program, but even with that, they were never designed to cover 100% of your out-of-pocket costs in the event that something happened. Voluntary benefits are often used for replacing lost wages or savings, to help out with household bills, travel expenses, and more. They also provide flexibility to choose benefits that meet your individual needs. The primary goal of Voluntary benefits is to supplement your medical insurance, and we have a lot of kind of incentives within our programs to also promote wellness and promote a healthier lifestyle and preventative measures by offering benefits for certain wellness and health screening tests. And I'll cover that briefly as I cover the next slide. Let's take a look at which voluntary benefits are available to you as a Dallas County employee. We provide a group accident plan, a cancer critical illness program that's called our group specified disease program. It's kind of a hybrid plan that encompasses both types of coverages. We have a short-term disability, and that is the plan that is available to cover the being off of work for the first 6 months if you're unable to work due to an accident or a sickness. And then we have a hospital indemnity insurance program designed to help indemnify you with unexpected expenses, to just kind of supplement your major medical. And then we'll talk about a whole life insurance program that that is designed to provide you with whole life insurance. So I'll cover briefly how the accident plan works. The group accident plan helps offset unexpected medical expenses such as emergency room fees, deductibles, and co-payments that can result from a fracture, dislocation, or other covered accidental injury. Benefits are payable directly to you. We don't pay doctors or hospitals. They're available, coverage is available for you, your spouse, and eligible children. And these plans can cover you and your spouse on or off the job. There's no medical questions or physical exam required to obtain coverage. And these benefits are not reduced by any other insurance or payments or coverage that you may receive elsewhere. So they are designed to help with those first dollar expenses that may come up as a result of an accident. It includes a $50 wellness screening benefit. We have about 24 wellness screening tests that are covered. If you go and have one of those tests once per year, you would receive that $50 benefit. And we have 2 plan options available, basic and preferred. This is kind of an example of how the basic plan works. I'll use an example of little Milo here. Milo was running on the playground when he tripped and injured his hand. Because the accident plan gives you lump sums for specific services and or injuries, under the basic plan, Milo's parents were able to pay the annual deductible and co-payments that exist with their major medical. So in this example, Milo's parents got $100 paid directly to them because they had to go to the emergency room for little Milo. They received $50 for the x-ray, $50 for lacerations, even though there was no stitches required. He had a fractured hand, so that was a lump sum of $1,020. And for the splint that was required, it was a $75 benefit, and then there was 3 follow-up visits. So those were totaled $150. So Milo's parents got $1,445 that was paid directly to them that they were able to use to offset their deductibles and co-pays that existed on their major medical. So this is an example of the group accident plan that is available with Dallas County. The preferred plan is the other option that's available, and Olivia here gives an example of how that plan works. Basically, both plans cover very similar benefits. It's just that the preferred plan pays a higher benefit than the basic. So in Olivia's example, she's driving in Dallas traffic. She went to the store when she got in a car accident, and under that particular plan, she received $300. That's a lump payment because she had to have an ambulance. There was $150 because she ended up going to the emergency room. And remember, under the basic plan, it was only $100. Under this plan, she received a little bit more than under the basic plan, where the basic plan paid $50. Under this one, for X-ray, she received $60. And then for medical imaging, she received $200. And then there's some hospital admission benefit. There's $1,000 benefit under the preferred that she could use to offset her major medical deductible. Because she stayed more than one day, there's an additional $750 because she's paid an additional amount for every day she stays past that admission. And then there's lump sums for the actual injury. So $6,300 as a lump sum. And then there was some exploratory surgery, medical equipment, follow-up visits, and physical therapy. So Olivia received over $9,300 that was paid directly to her, and she used that to help offset some unexpected medical bills, help out with the deductible and the co-pays, and use that money to help her recover as she should. The accident plan, I will tell you, starts out at $5 and some change roughly for Dallas County employees. And like I said, it is guaranteed issue and available for any Dallas County employee and their dependent. It does cover dependents even if they are playing recreational sports. So next is probably the most utilized plan from Dallas County employees is the short-term disability. This particular plan replaces a portion of your income to help make ends meet if you become disabled from a covered accident or sickness. It is designed to cover the gap until your long-term disability that Dallas County provides for you kicks in. That the long-term disability, as you may know, has a 6-month wait on it before it kicks in. So the short-term can help pay for the first 6 months. Included in the short-term disability from Colonial Life is psychiatric and psychological benefits. So if your doctor says that you can't work due to a psychological reason, that can trigger your short-term disability being payable. There's a health screening option available to pay you another $50 to encourage you to go for your wellness screenings. And it's a very simple claims process. You would start the claim online, basically telling us why you're unable to work. Your doctor would verify that, giving us a diagnosis. And we partner with Dallas County Benefits to verify that you're actually not working. And that is how we handle the claim process. How it works is you use the benefits where they're needed most, so the money comes directly to you. They're payable monthly to you regardless of any other insurance. It is not reduced based on sick leave or any other benefit. Potentially available if you return to work part-time. So if you can work but only part-time, there are some ways to still get some partial benefits, and it is your plan. So once you get it, you can port the plan with you. So some of the reasons why I see people use this plan is to help out with mortgage or rent payments, groceries. Covered conditions can include pregnancy and childbirth, back and joint disorders, accidents, fractures, cancers, heart attacks, strokes. For any reason, if your doctor says you cannot work and do your job, then the short-term disability may be a way to replace your income. You do have a little bit of flexibility. You can decide how soon it kicks in. It can kick in as early as first day if you're a new hire and you haven't built up a lot of sick leave, or if you have a lot of sick leave, you may want it to kick in after a month or after 2 weeks. So you do have some flexibility, and also it can pay up to 60% of your income. Okay, so great benefit there. The next plan that's available is the hospital confinement indemnity insurance. It provides a lump sum benefit for a covered hospital stay or outpatient surgery that can help out with the co-payments or deductibles that may be required under your major medical plan. Dallas County also has included a doctor visit reimbursement under this plan. So you can, depending on the plan you have, you can be reimbursed up to 5 doctor visits for any reason. Also, health screening benefit is included to pay you $50 a year to encourage you to go for your wellness screenings. And then there's some additional emergency room and ambulance reimbursements. And as I said, some outpatient surgery benefit is included. Again, then another plan that benefits are payable directly to you and usable for any purpose. It includes outpatient surgery, ER visits, and more, available to you, your spouse, and eligible children, and clear benefit amounts so you know exactly the amount payable that's available to you. Okay, so that is that plan. The next plan that's available, let me see if it'll let me go here, is the critical illness insurance. This is called the group specified disease. When you go into the enrollment platform, it's designed to supplement your major medical coverage by providing a lump sum up to $75,000 actually, that you can use to pay costs related to cover critical illnesses like heart attack, stroke, or cancer. So it is not designed to replace your major medical, but if you've ever seen anyone deal with something like cancer or a brain tumor or a heart attack or a stroke or a loss of hearing, loss of sight, there are a lot of indirect expenses associated with dealing with those conditions. So this helps offset the out-of-pocket expenses that may come about as a result of those, or non-medical expenses that one did not count on. So in 2000, last year, it was expanded to cover hospitalizations due to COVID-19. Health screening benefits are included with the plan. You can decide whether you want it to cover major heart-related situations and decide whether you want to include cancer as one of the major benefits you want to cover. It can be used to cover deductibles and co-pays, out-of-network treatment and additional medical procedures, travel and lodging and meals that may be required, gym memberships and smoking cessation programs, rehab and home health services, and childcare. If someone is dealing with a unexpected disease, they would get the lump sum of money and they can use it for what they see fit. Just to share some of the ways I've seen people use this, I've seen people use it. There's a lot of specialty cancer treatments centers popping up across the country. I've seen people use this money so that they can themselves and take a companion when they go to a facility like that. I know an individual who actually has some immobilization due to a heart-related situation, and he needed some additional help in his home. He actually used the $30,000 that he had signed up for to do some modifications in his home so he wouldn't need as much help. So my motto is you don't want money to be the reason why you can't get the care that you need. So this is a great benefit that's been very helpful to Dallas County employees in their time of need. Last but not least is whole life insurance that we provide. You guys have an excellent group term life program with another vendor here with Dallas County. But if you do feel you want a permanent life insurance for yourself, your family, or dependents, even grandchildren, Dallas County has now made that option available. It can be payroll deducted. It's life insurance that covers you the whole of life. Once you get a life insurance program with whole life insurance, that rate is locked in no matter how old the person gets or whether you leave Dallas County. That is your program. Rates are for whole of life. It does have some living benefits, meaning that you can pull down some of the monies to help out with chronic care or critical care related situations. Coverage is available for spouse, dependents, and grandchildren. You do not have to get life insurance on yourself in order to cover a spouse or a grandchild or a child. So that we do have standalone options, and during open enrollment, we have guaranteed life option. So you do not have to qualify for certain amounts. There's no physicals required for certain amounts, and there are some guaranteed amount options available. Another benefit is it can accumulate cash value. Part of your premium goes into a cash account that earns a guaranteed interest rate, and it does provide death benefit and flexible premium payment. So the whole life insurance is available to you, payroll deducted for you and your family. There are some additional benefits that are available that we provide to Dallas County. One, during open enrollment only, we provide an additional accidental death and dismemberment coverage, and that is whether you get any of the voluntary programs or not. If you talk to a benefit counselor, all we need to obtain is your beneficiary. It's a complimentary offering that we provide only to Dallas County employees. It's free of charge for each employee who meets with a benefit counselor during open enrollment. This is a plan that is on a annual basis. You have to tell us that you want to continue it. So only during open enrollment is it available to enroll in that. And then also the well card. I get often asked about the discount well card. It provides savings on, you guys have a great drug plan, but so you may not need it, but someone in your household who is not covered under your benefits may benefit from discounts on prescription drugs, diagnostic testing, or even virtual veterinarian visits. So if you have a furry family at home, we do have some vet benefits on the well card service, well card. Also, it provides a medical bill advocate called Call MD that is built into the plan, and it also offers family entertainment discounts. So you can get discounts on movie and theme park benefits, and it's free when you attend a one-to-one virtual session with a benefit counselor, or you meet with a benefit counselor when we're on site during open enrollment. So that is a great benefit that's available too. We do try to make sure we have personalized service and flexibility to meet the way you want to meet. So in our partnership with Dallas County, our benefit counselors can provide a tailored advice to ensure you will have the opportunity to meet with a live person if you want, to help you kind of navigate some of the options that are available to you. But if you're a do-it-yourselfer, you can enroll your way. You can go to the enrollment site on your own, or you can, like I said, meet virtually or by phone with a benefit counselor. We'll give you access to a Calendly so you can book when it's convenient to you. 97% of the employees said that their benefit counselors actually help improve their understanding of their benefits overall. I do have a enrollment guide that I'll kind of put in the chat. So if you are a do-it-yourselfer, how you can get into Employee Navigator and navigate your way into looking at your benefits. But I just want you to know that we do have live people that are available to help you if you see that, if you feel the need. So a couple of links here that I'll put in the chat. One is the Calendly to schedule an appointment. And also you can go to learn.coloniallife.com/Dallas County TX to see your brochures and additional info. But those are next steps. And then I will put this information in the chat so that you can see all the ways that you have access to take advantage of the benefits that are available to you. So with that, I'm going to turn it back over, and I look forward to assisting you guys for your benefits with Dallas County from Colonial Life for 2023. Thank you, Sam.
Thank you so much, Akila. That was excellent information. We really, really, really appreciate your participation today. And with that presentation, that will conclude our virtual meeting today. I would like to thank every single vendor who made the time to come out today, who worked with us as there was some technical difficulties and everything. You are all, very professional, very informative, and I really appreciate y'all working with us today. So again, that will conclude our meeting. And we appreciate all your help today, and we wish you the best. Thank you.
Thank you.
Thank you.
Thank you.
Bye-bye.